I'm Ezra Raya, and this is the Manila Times. The House of Representatives has finally approved House Bill 8910, or the Adolescent Pregnancy Prevention Act. The bill seeks to create an interagency task force to fight teenage pregnancy, which have been on the rise since the pandemic. The Adolescent Pregnancy Prevention Interagency Council will serve as the policy-making body in charge of formulation and implementation of programs under the bill. This will be led by the Commission on Population and Development, along with other agencies such as Department of Health, Department of Education, and DSWD. Other agencies as well as women's rights representatives. Last year, lawmakers from the lower house expressed disturbing rise of child pregnancies. Teenage moms as young as 13 years old give birth, and with the youngest reported at 10 years old. In 2022, Popcom, now known as CPD, rang the alarms on the continuous rise of adolescent pregnancies in the country and considered it a national emergency. Joining us is Commission on Population and Development, CPD, Deputy Executive Director, Lolito Tacardon. Welcome to the Manila Times, sir.
Thank you for this opportunity po.
Sir, first off, tell us about the current state of teenage pregnancy in the country.
Yeah, based on our latest data on adolescent pregnancy from various sources actually, um, primarily from the National Demographic and Health Survey of 2022, we have noted declining proportion of adolescent pregnancy, but that's actually just 15 to 19 years old. And that is also reinforced by another study by the UP Population Institute through the Young Adult Fertility and Sexuality Survey, which also indicated a declining trend, from 13% to around 6% in 2013 to 6% in 2021. Under the National Demographic and Health Survey, actually the decline was from 8.5% in 2017 to 5.4% in 2022. But what's alarming is based on the civil registry and vital statistics, the live births born to 10 to 14 are actually in the upward trend. So it's really increasing, from nearly 2,000 in 2020. We got the latest data was actually 2021, but even then we noted 100 pregnancies increased from that segment of adolescents. So it's now around 2,300, and we are expecting actually a rebound of these incidents because of as we know, a more lenient interaction now with among adolescents with the return of adolescents in the schools, and the removal of the restrictions when it comes to curfews among them.
Sir, like you said, the return on face-to-face classes, with the return of the face-to-face classes, you expect that there will be another increase on teenage pregnancies. Sir, I have to ask, with the data that you've gathered, you mentioned an increase from those age group of 10 years old to 14 years old. And I noticed during the pandemic, so most of these adolescents were forced to stay at home. Do you have any information on how many of these cases are sexual abuse cases?
While we are in the process of verifying the information that we gathered from those recorded through civil registry, the civil registry data also indicates some semblance of and incidents of sexual abuse, especially in the data which shows that most or a great proportion of live births born to adolescents adolescent mothers aged 10 to 14 actually were sired by partners who are actually older than them. So it's on the average it's around 21 years old yung yung mga partners nila, no? So if ikukumpara mo yung 10 to 14, those live births were really sired by older men, no? So 21 pataas yung karamihan sa kanila. So in our within our, of course, legal system, lalo na with the recent policy that increased the age of sexual consent to 16, automatically those 10 to 14 cases ng pregnancies are already illegal, and can be considered as sexual abuse already, no, para statutory rape na kasi yun, regardless of their consent. So in practical terms, if in relationships where you have a very young girl and the partner is an old male, for sure there will be incidences of sexual abuse or some probably exploitation. So that is the main indication that there are really sexual abuse that are happening among this segment of adolescent girls.
Sir, Albay Representative Edsela Diman said that adolescent pregnancy is a global concern. On the other hand, a health expert from the Department of Health said stronger sex education among the youth is what's needed. So, sir, for your agency, what are the specific factors in teenage pregnancies or even adolescent pregnancies that the CPD aims to address? So, na-mention nyo rin po na yung sa age group na not even teenagers, were causes of sexual abuse. So, what other factors and what specific factors the CPD aims to zero in?
Actually, the intervention, policy intervention for addressing the issue of adolescent pregnancy was already, it was ano na talaga to, matagal na rin nating kinakamada to or dinedevelop. Actually, before the passage of HB 8910 at the lower house, we were able to secure an executive order from President Duterte then, EO number 141, to make this incidence of adolescent pregnancy as a national priority. And under that executive order, actually, we have identified 5 critical factors that we should focus on. One is, as you mentioned, the lack of information on sexuality. So that can be addressed by comprehensive sexuality education, and not only for adolescents but also for adults that have influence over the behavior of young people, particularly mothers, teachers, and service providers. Because studies have shown really that even while the main source of information of young people when it comes to sexuality remains their peers, yung mga peers pa rin na napupuntahan, mothers or parents play a very critical role in providing the appropriate information among young people. And in school, the teachers also play the role of play that role of guardians and of adolescents, and so proper information should be provided by them. Another is the lack of access to reproductive health services, because right now I think one of the legal barrier, especially among minors who are sexually active, victims of violence, and already those who are already pregnant, is the requirement for parental consent. No, so even if they already have children, but if they are minor, they have to get permission from their parents to use particularly family planning services. Another is what we just have discussed, the incidence of sexual abuse. So there's really a need strengthening of the enforcement actually of existing laws, like that set up mechanisms to prevent and manage sexual abuses or gender-based violence, such as the Magna Carta of Women and the Anti-Violence Against Women and Children Act, like the BAUSI desk and the other mechanisms at the local level. And nextly, we are also looking into the factors such as the socioeconomic factors that influence also sexual behavior among young people, like poverty, the lack of education, the lack of employment, That's why one of the strategies, one of the pillars also of interventions that we are working on is the improvement of the socioeconomic conditions of young people. And lastly, one of the pillars of the intervention that we're also pushing is that there's a need to channel the energy of young people towards more positive and productive activities. No, and that would be under the platform of youth development and community development participation, which in our case, that should be facilitated by the Sangguniang Kabataan. They should be providing the venue for that, no, kasi yan naman talaga yung talaga na mandate ng mga kabataan to increase youth participation, and they're doing well naman when it comes to sports and cultural activities that we think can also provide the platform for them to channel their energies into more productive results or outputs. But we'd like them to be more also sensitive and cognizant of other issues such as this teenage pregnancy. Kaya under the EU 141, the SK was actually provided with the mandate to take the lead in addressing this issue within the local youth development plan. So those are the areas that we are focusing now.
Sir, aside from based on what you said, so the information and aside from access to reproductive health services, so palalawakin nyo rin ho, magkakaroon ho ng tanggapan nationwide, tama po, para dito sa to prevent teenage pregnancies. So it will be a whole of nation approach. Oddly enough, a few months ago, the DOH and the DepEd partnered to fight the rise of HIV cases among the teenage population. So kasama po ito, so with your data on the rise of teenage pregnancies ay nagkakaroon din ho ng pagdami ng sexually transmitted diseases on another issue. So what specific programs do you plan on implementing to prevent teenage pregnancy or unsafe sex overall? Siguro po yung uunahin ninyong program. You've mentioned 5 critical pillars in your approach.
Actually, all of this within our organization or agency, the Commission Population and Development, we have included this in the Philippine Population and Development Plan of Action, which a significant part or an integral part of that is adolescent health and development. And within our mandate, we will be capacitating local government units to come up with these programs at the local level, because local government units are actually at the forefront of this issue, and they have the primary responsibility really to provide that enabling environment for young people to prevent adolescent pregnancy. So our role is just to capacitate them and provide them with the necessary skills and even, if available, resources that they need to set up this comprehensive program. And that's under what we call our technical assistance to the devolution, full devolution policy. Right now, we are also specifically mandated by under the 2022 General Appropriations Act to develop a social protection program for adolescent mothers and their children, which is actually part of House Bill 8910. And under this program, what we are doing is to establish also mechanisms to mitigate the risk and vulnerabilities of adolescent mothers. So the principle is that even if nabuntis yung mga nanay, kailangan pa rin natin silang protektahan because of the, as we know, long-term and lifelong consequence of teenage pregnancy. For one, yung pagtigil nila sa pag-aaral, sa the potential na wala silang maging trabaho, and the health implications and other risks and vulnerabilities of adolescent pregnancy. So para mabigyan naman ng chance yung mga batang kabataan na mga batang ina, as we say, ay dapat meron din silang protection na binibigay yung government for them, and that the same pillars will be provided to them, plus of course yung social welfare services na gusto nating maibigay sa kanila, and more explicit yung family planning services para maiwasan din yung repeat pregnancies actually na nare-realize din nila. Marami ring mga kabataan kasi na once na nabuntis sila na nagkakaroon ng repeat pregnancies, and we don't like that to happen, to aggravate their situation. So that's the one of the key interventions na ginagawa po natin. Of course, our agency continues to develop different approaches na pwedeng i-adapt ng mga iba't ibang institution. Actually, we are also part of the collaboration between DOH and the Department of Education, and we call that Adolescent Reproductive Health and CSE convergence actually. So parang the idea is from information from school that should be translated into actual access to needed services, lalo na sa mga health facilities. And under 8910 or HB 8910, one of the interventions then that we are trying to set up, especially at the local government units, are the information and service delivery networks to ensure the continuum of care for young people, especially yung kanilang mga health and other social welfare needs.
Thank you so much for that, sir. So in short, the CPD will be working on not only short-term but long-term solutions to end teenage pregnancies. Maraming salamat po, Commission on Population and Development Deputy Executive Director Lolito Tacardon.